You're listening to the Confident Choice Podcast with me, Dr. Roberto Garcia, a double board certified facial plastic and reconstructive surgeon. Honest conversations and expert advice about the decisions that make you feel your best. Hey everybody, welcome to the Confident Choice by me, your host, Roberto Garcia, a double board certified facial plastic surgeon located in beautiful and sunny Ponte Vedra Beach, Florida. This is our first episode, so we're going to be talking about a lot of things in the coming months, and we really have felt the need to educate our patients, and now more so educating everyone who's contemplating making this decision and really what amounts to a pretty big decision. And so today we're going to talk about how to make that confident choice. And one of the first issues that one of the first conundrums that they have to face is, why do I care so much about my appearance? And one can make the argument that they're being vain, that they're being meaningless, that they're not putting priority on the right things. And I have this feeling that it's not vanity. And when you care about your appearance, it doesn't mean that you care less about other things. What it means is that the way that you perceive yourself is very important for how you might portray emotions to others. And I'm married, I have three wonderful children, and the way that I portray my positivity to them in turn makes them better people, right? And so that's kind of a hard concept for individuals who have not yet felt the pain of aging, or have not felt the emotional pain of getting older, or having a defect of some sort from birth. Those individuals that are critical of people getting things corrected have not felt that pain. So it's not fair for them to judge you on their interpretation of your pain. And what I mean by that is, when you look at why is it that you should potentially seek improvement, it really comes down to, how tired have you become of beating yourself up every time you look in the mirror? Beating yourself up every time you take a picture or a selfie. Imagine if you were to walk around all day long, constantly saying to yourself in your inner voice how ugly you are, how malformed you are, how fat you are, how stupid you are. You eventually start believing that, right? It's kind of that self-positive talk. Tony Robbins talked about it long ago, the original podcaster. And if we're able to help you really eliminate that negative talk, which is in turn making you more negative, imagine how much more loving and how much better of a person you would become to others if you constantly spoke positive to yourself, right? So, you hear about the abused child, right? That he was constantly told this, he was constantly picked on by his parents. You see those individuals as adults, and what do they become? I mean, they have no confidence. They have been emotionally beat down because they were told constantly how bad they were, how negative they were, how ill-behaved, how ugly they were. But imagine if you had that same child and you raise them telling, hey, it's okay if you screw up. This is how we're going to find a way to make it better. You're doing a good job. Let me help you improve. That child then learns self-validation, accountability, and learns how, hey, listen, I'm not perfect. I can improve myself. And that individual grows. And one day that individual is going to pass that positivity on to a world of people. So the question is, what gets you motivated to improve something? And it really comes down to, you're tired of the negative talk. And I will see patients, probably anywhere from 3 to 4 new patients daily, and almost every one of them comment that they're sick and tired of being tired looking. They don't feel inside what they see reflecting back to them in the mirror. And when a patient comes to me in consultation, they'll say, hey, what do you think I need? And I can give them a medical examination. I can tell them, okay, these are the things that are really that are jumping out to me. But guys, at the end of the day, it doesn't matter what I think, because I'm never going to look at you as much as you're going to look at you, right? I'm going to get maybe a dozen views of you in our relationship within a year span. You're going to look at yourself a dozen times in a day. I can't compete with that perception. So what's most important is, what do you see? What is it that's bothering you? What is it that got you to start the process of self-analysis? And it's a very bold and it's a very humbling decision that somebody must make in order to come to the decision, I need to correct something. It's very humbling. And so I commend my patients for taking that first step, because that's a huge leap of self-analysis and accountability. So the second part of what I think is a very important step in the decision, where do you start gaining information, right? I mean, obviously, you're not just going to pick up the yellow pages. Well, the yellow pages don't even exist anymore. You're not just going to randomly go to somebody. You're going to look for an individual who has, good reviews, who has an established name in the community. You may have even seen some of their work, which is always very valuable. And maybe you have the opportunity to Google search them and go to their website, right? So websites now are the source of information for everything. And on most websites, most doctors are going to show you, at least in our field, they're going to show you information about each particular procedure. They're going to show you before and after pictures. And from there, you're going to get the information. You're going to say, okay, I like the way this doctor works. I like the naturalness that his or her patients have. I like the fact that none of them look like they've had anything done. And from there, you're going to start looking at the reviews, because at the end of the day, if you were to kind of consider what a review is that stamp of this doctor performed and followed through on his promise to me, right? He told me, he or she told me, I am going to have this result. Not only did they deliver this result, but they took care of me afterwards. And that's really what a review comes down to. And that's why I feel that the value of the review speaks more to the character of the physician and the practice than anything else, right? You can have a physician who has good before and afters. I've seen that. But the practice may not have that character of embracing your pain, right? Helping you understand that it's okay for you to face this, and that you have a group of people in a practice that are willing to aid you in this process, right? They're going to walk with you. And I think that chasing after rankings and website SEO and all that stuff, that's not where you find the right physician. You find the right physician by asking yourself, will this individual be there if it doesn't go right? That's the question that you should be asking in that initial phase. And next week, when we get into what's actually being done in a consultation, I'm going to kind of go in detail of A, what are we physically doing during the consultation? But B, what am I, the physician, looking for from you? It's not a one-way interview. Now, you may be interviewing me and saying, okay, is this the right surgeon? But I'm also examining and interviewing you to see if you're doing it for the right reasons. I've had patients that come in with spouses or boyfriends, and the spouses and boyfriends were more interested in the flaws of the patient than the patient was. And that's a huge red flag for me, because that individual, like me, is not going to see you as much as you're going to see you. And a lot of people, unfortunately, will tell me that they're doing it because they want their husband to see them as young again. And unfortunately, that's not the right reason to do it. The right reason to do it is that you will feel better about yourself. And if your husband is really, really interested in you changing something about yourself, and you're not 100% about it, then you need to consider maybe not diving into it and getting a little bit more information, right? And so I'm very honest and frank with my patients, and I'm trying to find the right reasons as to why they're doing this. Why are they willing to make this, sometimes a sizable improvement, a sizable change. So there's a lot of self-analysis that has to come into it, and you and I, as the physician and the patient, have to be on the same page, and we have to see the same things. And if I can't see what you are concerned with, then I can't help it. And I'm never going to offer a surgery to a patient that I don't feel 100% that they need. And so, or more importantly, that a surgery that I can't see a result with. I can make up things and I can tell you, hey, yeah, you should do this, you should do that. But is that really addressing what's bothering you? And again, what matters to me, at least, is what's bothering you. So leading into the final point of where I think that it's so critical for the confident choice to be made, a proper confident choice, is timing. And when is the right time for me to do something? And I have patients constantly that they're in their 60s, 50s, 60s, and they say, you know what? When I was in my 30s, I thought for sure I would never do this. And it was so superficial. I'd see individuals on television, I'd see individuals in movies, and I always thought, wow, that's so superficial. Why would somebody do that to themselves? And now that I'm 50 or 60, I understand. I see why it is that they did that. And timing is a very, very personal choice. When to do it really comes down to when you are sick and tired of putting up with the pain. Really is what it comes down to. And some individuals find themselves in their 40s wanting to do something as a form of maybe kind of prevention, um, treating some issues of aging. Of course, there are patients that age earlier, and there's the genetic component to aging. There is certainly the lifestyle component to aging that can hasten the process. And then there's individuals that just seem to age really well, that they can wear wrinkles really well. They can wear sagging, to a certain degree. They can wear it well. And so it doesn't bother them until later in life, once that tipping point of aging occurs. And so the right time is very, very personal decision as to how long do you want to continue to beat yourself up emotionally over something that you don't like. And the surgeon, more than likely, if they're an honest one, is going to sit down with you and say, all right, this is where I see what you're talking about. I don't think you need to correct all of these things. I think we can focus on one or two things and make a profound change with that. And I mean profound as an emotionally profound change, and stop there. And then if we need to tweak something down the line, we do. And that's probably my main way of doing consultations is a person comes in and they say, I want this, I want this, I want this, I want this. And I really get to, why are you really here? Well, it's really my neck and my jawline that are bothering me. Well, why don't we start by correcting that? Because oftentimes you think everything's wrong instead of just saying, let me get that one thing right. And then all of a sudden I fall back in love with my face and I don't beat myself up. And that's the most important thing. So I'm going to end my podcast with what I think is a really fun thing. And my father, may he rest in peace, passed this past year. And my dad was my best friend. He and I spoke 2 to 3 times every single day. And one of the hardest things that I have now, since he's gone to heaven, is I don't have that daily conversation, And if I can tell you something about my dad, and I wish some of you who are listeners may have actually known him, but my dad was like a soothsayer. He always had advice for people. A lot of times when you didn't ask for it, but he always had such good pieces of advice that have just kind of burned into my soul over the years. And one of the things I wanted to talk about today's lesson, is doing hard things. And I remember my dad would tell me that if something's really worthwhile, it's got to be sacrificial. It's got to be really hard. And I first learned that when I was in college and I was taking a botany class. And it was a really hard class. I mean, I think there were 6 people that finished the class at the end of this semester. But I remember him telling me, he says, if it was hard, if it was easy, everyone would do it. And the fact that you find the hard in something is what gives it value. And that is something that I have taken to every facet of my life. If training was easy, if my medical training had been easy, it wouldn't have been valuable. The fact that it was hard is what made me into the surgeon that I am today. If marriage was easy, I probably would not still be married. The fact that it's hard is what makes you fight for it, right? And I think that in today's day, individuals kind of choose an easier path just by default, right? They don't want to be challenged. They don't want to be pushed. And so if there's any advice that I can pass on to you guys that was passed on to me from a very wise man, is that when you're choosing something, and you're between 2 choices, choose the one that's going to challenge you the most, especially you young kids. Choose the path that is harder to fight for, because number one, there's less people doing it for a reason. And number two, when you get to the top and you've gotten through all this hard, you're going to find out it's a very lonely road to the top. And the reason that it's a lonely road is because of the hard, but it's always very worth it. So I hope that I can share more wisdom or impart more wisdom that my dad passed on. But I think for a first episode, this turned out pretty good. And I think this is gonna be fun. We're probably gonna be moving venues. So we might be moving to an outdoor venue next week, we'll see. Episode 2, we're gonna talk about what's going on in the consultation. And again, I feel that the consultation is that primordial, extremely valuable moment where I'm with you for 20, 30 minutes and we're really getting to the id of the situation, right? The why, what the deeper core of why is it that you came in to this office? Why did you drive halfway across the town? Why did you go through all of these efforts so that you can change something about yourself that you feel that if and when changed, you will be so much better of a person to everyone around you, most especially yourself. So good decisions come from good information. I hope you have a wonderful week. We're always here to answer any kind of questions or concerns. So if in any of the comment sections you're able to leave some questions, our thought is we're going to answer some of these questions the following week, right? In the first segment of the show. And then we'll get to we'll try to get to 2 or 3 of them. And just remember that good decisions always come from good information. See you next week.